So today's webinar has been hosted by the Jain Health Initiative, which is a group of 33 Jain organizations working together to bring you the most up-to-date advice and information that's evidence-based from experts in different fields. Tonight, we've got a panel of some very learned gentlemen and gentlewomen who are here today to talk to you about COVID-19 and to really answer all those niggling doubts that you have. In true Jain method, we'll start first with the Navkar Mantra. So if you could just gently close your eyes, just gently reflect on the words and let us pray together. Namo Arihantanam, Namo Siddhanam, Namo Ayaryanam, Namo Vajayanam, Namo Loe Savasahunam, Eso Panchanamokaro, Sava Pavapanashano, Mangalanancha Savesim, Paramam Have Mangalam. First and foremost, I'd like to introduce Mr. Shah, who's the president of the Oshwal Association of the UK. Nilesh Bhai will talk to us shortly. Nilesh Bhai, over to you.
Thank you, Arshna. Good evening to all Jai Jinendra and Pranam Badane. On behalf of One Jain, which has 30 organizations working together, a very, very warm welcome for this evening's talk. We have been very fortunate to have a panel of our health experts who have provided us with a very useful and informative information for the past few sessions in relation to the topic relating to COVID-19. I trust that this has been very useful to all of you and would have cleared your minds and resolved the burning issues which you may have had. So on behalf of all of us, I'd like to say a very, very big thank you to all the health experts who had given their very useful time and given us their expert opinion and shared their experiences with us. One of the topics related to was in connection with having a vaccine. And I just wanted to share you my experience with you in relation to this vaccination. I had my first dose of vaccination last Monday. The process is so simple. You will receive a text or a letter from your surgery informing you to go online and book the appointment and the time you wish to visit. Your visit to the center at the time when you will be given and will be met by the person who will have all your details, and you will be given the full instructions when you go over there. The staff are very so friendly, and they'll show you where and where you will be vaccinated. You will then be met by a person who will ask you the few questions about yourself, and then will give you the jab. You also will be told the type of the vaccinations you will be given. There are several types of the vaccinations at the moment being given. I was given the Pfizer vaccination. You will then be given an information sheet which will tell you about the vaccination and a card of appointment for your second jab. With confidence today, I tell everybody today that there should be no fear of taking the jabs, and you will be able to be looked after by this friendly staff at the vaccination center. So far, I had no side effects nor any pains, and I strongly urge everybody should get this jab, as hopefully it will be preventing the measures against the COVID virus, not only for yourself, but all the family, friends, and all the people you are always in touch and working with yourself. So without further ado, I now hand over to Dr. Ameet Bakhai to commence today's session. Thank you, and I sincerely hope we'll be learning something very new today as well from our experts. Over to you, Dr. Ameet Bakhai. Thank you.
Thank you so much, Nileshbhai, for sharing your thank you, Nileshbhai, for sharing your experience. It really means a lot to our viewers to know that someone like you has had the vaccine and has had no effects. It really gives us a lot of courage to go forward and do that. So this evening's expert panel, we're joined by some very eminent speakers. We've obviously got Dr. Ameet Bakhai, who's a research director and cardiologist at the Royal Free Hospital Trust. We've got with us Dr. Nihar Shah, who's a general practitioner. We've also got Dr. Ameet Mehta, who'll be joining us a bit later on, who's also a general practitioner. We've got Dr. Raj Mehta, who's a scientist and an entrepreneur, who is also joining our esteemed panel today. So I'd like to hand over now to Dr. Ameet Bakhai to take us through today's proceedings. Dr. Bakhai.
Ameet.
I'm so sorry. That's the famous line of "You're still muted." I apologize for that. Hopefully that's allowed once per conference, and then that should be it. Thank you. So, ladies and gentlemen, thank you so much for joining us today. We are blessed to have a great panel with us today, and what we're trying to do is a conversational approach to an update of what's the latest that's going on. There are three important messages that we'd like to explain to you. Number one, COVID is still a war. It is never going to go away, and we cannot turn our back on it, and we will demonstrate that with a patient journey. Number two, the vaccines are here. They are our saviors in a potential way, and we've got more things to tell you about, and we'll understand about the mutations. And then number three, the most important thing is it's still business as usual for dangerous things like heart disease and cancer. It's really important that we do not delay seeing our healthcare professionals for those urgent things we need. COVID must not cause collateral damage with those aspects. And with that, I'm going to start with the patient journey that Mukesh Patel has been kind enough to allow us to show today. And this is when the BBC were actually filming at my hospital for weeks and weeks and weeks. This was a classic patient that allowed himself to be shown on TV for us. So thank you so much. We're going to take it away from the film of Mukesh Bhai. And Arshna, I should have introduced you. I'm so sorry. You're my great colleague and diabetes pharmacy specialist in Barnet. You work alongside me, and you always keep me in check, as you will do today. And so you are the controller, the head for this. So thank you so much, Arshna. And if you could take it away to the video, please, of Mukesh Bhai.
Potentially classic COVID. Potentially classic COVID.
The patient.
Potentially classic COVID.
The patient causing Tim most concern is 62-year-old post office manager Mukesh Patel, who has COVID pneumonia.
Hello. Yeah, so my name's Tim. I'm one of the consultants here. Just been looking through your notes and your x-rays and everything. How are you feeling now?
Still pretty terrible, to tell you the truth. For the last couple of days, it just got worse.
And that was the breathing now as well?
Yeah.
And you work in a post office, is that right?
Correct.
Okay.
I believe I must have got it from there, because I can just go work, home, work, home.
Yeah.
Can't see where else I could have got it.
Yeah. And were people wearing masks when they came in, or not always?
Not always. There are certain amount of people with attitude, unfortunately.
Looks like this is a COVID effect on the lung now. So we know you've got COVID. The oxygen level was quite low, but is being maintained by the oxygen that you're breathing in, which is reasonable for the moment. But
Potentially classic COVID.
The patient called.
Pretty terrible, to tell you the truth. For the last couple of days, it just got worse.
And that was the breathing now as well?
Yeah.
And you work in a post office, is that right?
Correct.
Okay.
I believe I must have got it from there because I can just go work, home, work, home.
Yeah. Yeah.
Can't see where else I could have got it.
Yeah. Yeah. And were people wearing masks when they came in, or not always?
Not always. There are certain amount of people with attitude, unfortunately.
Looks like this is a COVID effect on the lung now. So we know you've got COVID. The oxygen level was quite low, but is being maintained by the oxygen that you're breathing in, which is reasonable for the moment. But we do worry that it might deteriorate, and certainly some of the treatments that we can offer now should...
Potentially classic COVID.
illness which is proven COVID with its swab on day 5.
Because of growing concerns about his breathing, Mukesh is being moved into intensive care.
Essentially had high temperature for the first week but no respiratory symptoms, and then started deteriorating from a respiratory point of view at home, and essentially has come in and he's now actually day 13 of when his symptoms started. Yeah.
He's likely to move to intensive care. Then he's eligible for Navkar trial as well. That has more treatment option for him.
Hello, sir. Welcome to ITU. My name is Barbara. I'm one of the nurses here. Barbara.
Untitled. Because I had a few family members who caught it, and they've been in ICU but on ventilators, and they didn't make it.
Mukesh will remain in the isolated COVID area of intensive care in case he needs extra breathing support. Mukesh and Saraj Patel have been married for nearly 39 years and have never spent any significant time apart.
The worst is not being able to see him here. I just can't imagine what he's going through. So that makes me more worried, more sort of anxious. I didn't expect him to go to intensive care. I thought he'd just be in general ward. I can't be there for him. That's what's killing me.
The computer has randomly assigned a treatment to Mukesh.
Randomization has chosen you to be on anticoagulation because it's a blood thinning medication. There is potentially a risk of bleeding, but we will keep monitoring you for that. Thank you.
Thank you.
Hey, Mr. Patel, you did it. You made it.
After 5 days on blood thinning treatment in intensive care, Mukesh has improved enough to be moved back to a ward.
Look at the sun outside. Very nice, huh?
So nice.
It's a good feeling coming out from
Yes.
Mr. Patel, I'm Sonal. I'm one of the doctors. I saw you before you went to the ITU.
Okay.
Yeah, how are you feeling today?
I feel lovely.
Great.
I feel very good.
You look a lot better than what you were before.
When I went into the ICU, I'll be very honest, I was shaking. I didn't know whether I was going to make it. I think the trial drugs pulled me through. Got a second lease. That's great. Yeah. Thank you. Thank you so much. Thank you. Thank you.
Mukesh is medically fit to leave hospital, but as his most recent positive COVID test was in the last 14 days, he must continue to isolate to protect his family.
Isolate.
Thank you so much. And I want to thank Mukesh and Saraj who are in the audience as well for allowing us to show that video. This is a typical, and on this occasion, we're really lucky that it was a positive outcome. It's a positive outcome that Mukesh went home. It's a positive outcome that he's protecting Saraj even at the end by isolating. And it's a positive outcome for the staff that actually, after all of the care and relationships we've built, that this is exactly what we want. But we must not turn our back on this. You know, COVID is there at any time. And one of the things I'd like to ask is I'd like to bring in Nihar. Nihar is a good friend of mine from Harrow and a GP. Nihar, what are your thoughts on seeing this journey that we face in the hospital setting? And what are your thoughts as a GP?
So, Jagan, everyone. Thank you to Jane Health Initiative to allow me to speak in this talk. Ameet, you know, I've seen this this video 2 or 3 times now, and there's a huge range of emotions and thoughts that keep flooding in at each time I see it. Of course, the main emotion would be happiness that he has survived. He's gone through a very difficult journey. As you know, he's a BAME patient. So for those in the audience who don't know, it's Black, Asian, and ethnic minorities. Mukesh is a male. He's Asian. He's middle-aged. So he's got all the risk factors for catching COVID and for potentially doing very badly with COVID. He also went into ITU, which is another very poor prognostic sign, and yet he survived it. So I suppose the main thing is that there's huge elation that he's done this. You get also other thoughts that come in. You get anger. You get anger because here was a man who, like many of us, are just doing a normal day's job, and because of potentially people not necessarily following government advice in terms of wearing masks, he did say people in the post office were coming in potentially not wearing masks, and that's possibly how he caught it. So you know, that's caused a lot of suffering to him, a lot of suffering to his family. At the end, when he had to meet his wife was desperate to hug him, and she could not touch him, and he stopped her from touching him. And again, these are different. All of these things cause a lot of suffering to patients. And I think also there's this feeling of amazement because he mentioned that he was given some anticoagulation. So Mukesh was, you know, he was very lucky. He was in a hospital which was at the forefront at the time of fighting COVID. He was enlisted in a number of potential trials. So there's trials with lots of new drugs. We're learning from this all the time. And he was very lucky. He was given that, you know, given the best treatment possible at the time. I know that there are many hospitals at that time who were not giving anticoagulation to patients, and people were suffering from that. For those in the audience who don't know, anticoagulations are blood thinners. And obviously, you know, the Royal Free, you were at the forefront of that. So all of these things may well have helped him. And I suppose the other things we need to think about from my point of view as a general practitioner is, could we have prevented the admission in the first place? And obviously, if from my point of view, we could have prevented it if we had followed government advice, the hands, face message. If, for example, everyone had worn masks. I'm not sure if he actually went to see his GP, but for example, currently, if he had come into primary care early, we might have been able to stop his admission. And we can perhaps talk a little bit about that at a later stage. Did we have to get him into ITU? Obviously, he was admitted to the first wave of the pandemic. Could there have been things we could have done at that time to perhaps prevent his admission into ITU? We now have a lot of new drugs, again, because of constant medical knowledge, constant collaboration between different hospitals.
So this is a nice place to pause, Nihar, that you've amazingly picked up so much from that. You've picked up the psychological aspects, you've picked up the prevention aspects, you've picked up the research aspects and the clinical aspects. And I know now, post-second wave, a lot of people are having pulse oximeters at home so that they're able to detect things early. They're able to see their GPs and call them to make sure that, you know, there is a need to be able to go into hospital and then try and manage that, etc. And in fact, in casualty, we're also checking very carefully, do you need to stay in or not? And it would not be surprising that if you're at an early stage, we may even let you go home from casualty. If it's okay with you, Nihar, I'm just going to spread it out a little bit. So just quickly, Raj, any comments? What about the research side, the research invitation? It's a research hospital. And you're on mute too, buddy. We're allowed one each.
This is a very poignant video. What I'll be interested in as well is actually the demography of people that are entering the hospital now, right? That it seems, since the last pandemic, this last lockdown in March, April last year, we're seeing a lot more younger people entering the ICU. And that is actually, on one hand, worrying, but also it is a very, very strong indication that we all, including the young folks, need to self-isolate. We need to follow the guidance.
Absolutely. And so the average age is being moved down to 40 and 50, when in fact previously it was 60, 65 in the first peak. And we've got 75% more people in ITU now than we did in the first wave. So it's really filling up. Arshna, any thoughts and comments from your side on this? We're having a panel discussion as often as possible.
So I think the thing that really struck out to me was the emotions that people go through. So it's not only the patient, so it's not only Mukesh Bhai who was frightened, afraid. And I suppose the really good thing was he had his devices with him, he had his phone with him, he was able to communicate with his family. So if ever you are admitted, that's really important to have that communication open so you can at least talk to your family. You can have that visual FaceTime or, whatever, WhatsApp video, whatever experience that you can with them. And also for the people at home who are the loved ones waiting for news from your loved one in hospital, it's really important to stay positive, to stay well mentally, to reach out for support around you. So that really struck me. It's really important to stay positive because survivability is there. Mukesh Bhai came home, and it's not all doom and gloom when you go into hospital now, especially with all the research that you spoke about, Ameet. It's not all doom and gloom. So stay positive.
Actually, you've reminded me, Mukesh Bhai was one of the most, dedicatedly positive people that we've had. And in fact, I was really blessed that my research team there, Vinod Krishnamurthy, I must say hello to him. He's recruited over 300 patients with Hassan Tahir, a good friend of mine, into research studies. It's amazing. And then Sonal Sharma, who you saw there, the registrar, our lovely Sonal, hopefully she'll be doing a Hindi version of this talk in the future. But that's right, it is a little bit better. But actually, the poignant point that Nihar struck me was, if he'd had vaccination now, hopefully he wouldn't be going in. And actually, that's one of the most important things about vaccine. We'll see some data in a minute that actually it's reduced hospitalization rates greatly. I'm going to go to our second piece of data and then come back to us. So if we could play our second video, and this is a video from the World Health Organization. And one of the reasons that we're playing these videos is because we want our community to be able to see what it is we look at and how we appraise data, how we think about things. And so we're trying to give us a little bit of context about what are the sorts of media that we learn from and what's important and how to approach those. So please play the second video. Thank you.
If you've been vaccinated and have questions like when does immunity kick in and how long will it protect you and others, today we'll try to answer some of those questions in Science in 5. Welcome, I'm Vismita Gupta-Smith and this is WHO's Conversations in Science. And answering your questions today is Dr. Catherine O'Brien. Welcome, Kate.
Thank you so much. Pleased to be with you.
Kate, after one has been vaccinated, when does the immunity kick in and how long does it last?
The vaccines that we have right now are all two-dose vaccines. After the first dose, we see a good immune response that kicks in within about 2 weeks of that first dose. And it's really the second dose that then boosts that immune response. And we see immunity get even stronger after that second dose, again, within a shorter period of time after the second dose. We don't know yet how long immunity lasts from the vaccines that we have at hand right now. We're following people who have received vaccinations to find out whether or not their immune response is durable over time and the length of time for which they're protected against disease. So we're really going to have to wait for time to pass to see just how long these vaccines last.
Kate, after one has been vaccinated, can one still catch COVID-19, and can one also infect others?
That's a great question. You know, the clinical trials demonstrated that these vaccines protect people against disease. What we don't know yet from the clinical trials is whether or not the vaccines also protect people from just getting infected with the SARS-CoV-2 virus, and whether or not it protects against transmitting to somebody else. So this is a really important part of our understanding about what these vaccines do. Do they only protect against disease, or do they also protect against getting infected and being able to transmit to somebody else, even if you're not having any symptoms?
Kate, explain to us, why does one need to continue with the precautions even after vaccination, and how long are we expected to take these precautions?
So we really need to continue these precautions while we're still learning about what the vaccines can do. Can they protect against getting infected and transmitting to someone else? And right now we're in a situation where there's still very broad transmission in many countries. The transmission is just out of control. And so for how long we need to continue these precautions is really going to depend on what communities and countries can do to really crush this virus, to crush the transmission. And in that way, the vaccines can do their best job at preventing disease. But remember that we don't actually have the evidence yet for using the vaccine in some age groups. We don't have the evidence for use of vaccines in children, for instance. So for the time being, those age groups are going to continue to be at risk of both disease and infection and being able to transmit to other people. The second reason is that the vaccines are in short supply. So we don't have enough vaccine yet out in the community to protect everybody. Those are the reasons why we have to continue the precautions, especially the masking, the physical distancing, the hand washing, and not gathering in big groups. For how long we need to continue those interventions, time is going to tell. Once we get broad vaccination coverage in the community, when we know more about what the vaccine can actually do to prevent infection, we can slowly start taking our foot off the pedal of these other interventions and make sure that the transmission, again, doesn't start to escalate again.
Thank you, Kate. That was Dr. Catherine O'Brien. We'll continue to answer your questions about vaccines and immunity and about COVID-19 in this series. If you found this information useful, please share it with your networks. Until next time then, stay safe, stay healthy, and stick with science.
Thank you so much. So that was a video from the World Health Organization in just a few minutes telling us what we do and don't know about vaccines. Raj, I'm going to turn to you here and say, what are your thoughts when you're seeing that video? Where are we at with vaccines? Where are we at with immunity?
Well, I think the first thing that struck me actually, is something that you mentioned before. Scientists actually follow data. And when we don't know about something, we don't just make it up or suppose. As the lady said, the key question everybody has is, how long is immunity going to last? We don't know. However, we do know that there is immunity with using the vaccine. Hence, it's definitely worth taking it than not taking it. The other thing which is clear is we are at the moment in a race. It's a race between herd immunity from vaccination, i.e. getting everybody, as many people as possible vaccinated, versus a race against containing the virus spread. And that's really the key problem we have at the moment. How fast we can get people vaccinated at the same time, really keeping the spread as suppressed as possible.
I think that's a great idea. Now, one of the questions, Raj, I'm going to just stick with you, is we're going to be asked about mutations and whether the vaccines are working against the new mutations, and are mutations to be expected?
Right. So that's something that we really need to clarify, right? First of all, what is a mutation, right? Everybody wants to hear that the word mutation gets a little bit worried. So if you think about what is COVID-19 as a virus is a ball. It's a spiky ball that you've seen all the diagrams about. Inside the ball, it has a blueprint that it codes for everything it needs to be made, right? Once it infects our cells, this blueprint, which is about 30,000 bits of information, it has two main aims. One is it tells our cells to make proteins which allows the blueprint to be replicated. So it makes thousands of copies of itself. And it also allows it to make everything that makes up that ball and the famous spike protein that we know now. So essentially the blueprint replicates itself, makes thousands of copies of itself. And in that process of making thousands of copies, there are mistakes. You can't, at 30,000 bits of information being copied thousands of times, there are mistakes going to be made. And essentially what we call mutations are those mistakes, right? Now, why are we worried about that? There are thousands and thousands of mutations happening every time someone gets infected with this virus. In fact, COVID-19 mutation rate is a lot slower actually than even flu viruses or even HIV viruses. So this is not an abnormal thing the virus does. Viruses mutate all the time, they have mistakes. What is becoming clear is that some of these mistakes, some of these mutations actually give viruses an advantage. That's when we detect them as what we're calling variants, right? So we've heard about the UK, the Kent variant. We've heard about the South African variant. We've heard about the Brazilian variant. Why are we talking about those variants and not the other thousands and thousands of other variants that already must have happened in patients, right? The reason is that these variants have somehow gained an advantage. And what we're learning is that they've gained an advantage. They can infect people faster. And that's why you see them a lot more often in the community than actually all the other variants. The other reason why, just one second, the other reason why people are getting concerned about these variants is what's happening is interesting. That mistake that got chosen in South Africa, the same mistakes was seen in Brazil, and the same mistake has been seen in UK, right? So it's telling us that this mistake that the virus made is giving an advantage.
So over time, the virus is getting more efficient at trying to infect us by taking hold of these advantages, and it's learning about us. Now, I'm mindful of the fact that not only is it doing that, but viruses don't really want to kill us. They want to use us to multiply continuously, and it's our overreaction and our lack of fitness to look after ourselves when we're hit by a virus that actually we overreact in our lungs and it causes death. Is that correct, Raj?
Correct. So again, when you're looking at Nilesh Bhai's journey through the hospital, ICU patients, right? It's not the virus that's causing the lung problem per se. It's not the virus that's getting you the ICU. It's your body's immune reaction to the virus. Now, coming back to what people are concerned about, really, the main issue here right now, everybody's worried about is whether the vaccines will work against the mutations, right? The evidence we have at the moment is that all the vaccines, Moderna, Pfizer, and AstraZeneca, is working just as well against the UK variant. So for that, that's great news. We have evidence to show that. There is also evidence people are trying to look at, does it work against South Africa variant, against the Brazilian variant, and they work less well against those variants. One thing we got to remember, what we talk about when does the vaccine work or not, it's not black or white, right? Absolutely. What has been tested in the trials is whether you catch virus or not once you've had a vaccine. However, what's becoming very clear is those, even if you have had vaccine and if you catch the virus afterwards, you get lots less severe symptoms, right? And even then, on top of that, the chances of you being hospitalized and getting to ICU is even lower. Right? Even if the South Africa variant is slightly resistant to our current vaccines, what it still means is that once you had that vaccine, the chances of you getting severe version of the disease and being hospitalized are hugely, hugely less.
Absolutely. That is really reassuring. I'm going to take a comment each from both Arshna and Nihar. Arshna, you're hearing us talk about vaccines, you're hearing us talk about mutations, you're hearing us talk about sort of on target, off target, is the new vaccine, is the current vaccine going to work against new variants, etc. How are you feeling as we're discussing this?
I think there's just one thing that's going through my mind, which is the fact that what Raj just said is that if you've had the vaccine, your body has half a chance of knowing what to do when it comes across COVID. It's a bit like, when you know how to bake a cake, if you've baked the cake loads of times, you know what to do. So even if it's a new recipe, you sort of know what to do. And that's the same with the vaccine. If you've had the vaccine, if you come into contact with COVID or one of its strains, your body is going to know at least the basics of what to do, and you're not going to end up having this huge immune response and ending up in hospital and in ITU. So for me, that's a real take-home message that, the vaccine is going to help you.
You have just reminded me that the biggest virus on this planet are human beings, and we evolve even faster than the virus does. And that which does not kill us eventually will make us stronger. And I think the point that you've just reminded me, of course, is that Raj and Nihar, I remember being told that actually the whole mechanism we've done for learning how to create these vaccines to COVID-19, actually to tweak it against a new variant is going to be even potentially quicker. Is that correct?
Yeah.
That is correct. So that that's the modern vaccine technology allows us to tweak it a lot quickly. However, Ameet, one of the things that's actually very exciting, very comforting at the moment is not only the existing Moderna, Pfizer vaccines. Yes, we can tweak them and get revaccinated. But some of the other vaccines that's coming down the line, you've got some of the Chinese vaccines, the Russian vaccines, the J&J vaccine. A lot of those vaccines actually have a potential to work against a broader range of variants as well. So it's not just the existing vaccines that can be tweaked, but as time moves on, the new vaccines are getting better and better and better.
I mean, if you think the vaccine's innovative, just look at how human beings are being innovative. Nihar, what do you think about, do you think you're optimistic that we're going to be helped by so much technology, so much research?
Yeah, I'm actually very optimistic because of a number of things. I think the main thing is that there are newer and newer vaccines. I think there are over 100 different vaccines in clinical trial now. Second thing is to tweak the vaccine that we have to try and combat a new version of the virus is actually very easy from a lab and a technical point of view. The virus may be one step ahead, but we will be getting more and more advanced, and we will probably be having more boosters. So it might become like the annual flu jab, for example. So I think there's a lot of optimism on the horizon. And so, yes, I am very optimistic.
That's a really nice place for me to dovetail to something I'm going to share on the screen, guys. Now, imagine we are one of the few countries in the world that is able to present to you the information of the side effects of our people being vaccinated. And that is the beauty of being in the UK. I'm going to share with you here data from the MHRA, which is the governing body that regulates whether vaccines should be approved, whether drugs and devices should be approved, whether software and apps that are medical apps should be approved. And here is the data coming out of the Medicines and Healthcare Regulatory Agency. It has been following all of the people that are potentially submitting adverse events to the organization after they've had a vaccine. And just to show you the sorts of data that they're giving us, here is information on 23,000 submissions of what we call a yellow card system. So if something bad happens to me after a vaccine, anybody can report that to the MHRA through a simple online web form, yellow card, something like simple like my hair fell off, or I was not able to breathe properly after a vaccine, and those would be reported. Any healthcare professional coming across an unexpected side effect will report a yellow card. And now we've given almost 7 million doses of vaccine. You can see 5.9 million doses of the Pfizer vaccine has been given, 5.5 million doses first dose, and almost 500,000 in the second dose. And you can see here that over 1.5 million of the AstraZeneca doses have been given. So first of all, look how accurate we've been. Up to the end of January, We know that 7 million doses have been given, and 23,000 cards have been reported. And the rate of that reporting of any serious side effects is less than 1 in 250 people. So 249 times out of 50, 315 times out of 316, there are almost no significant side effects being reported. If they are being reported, the side effects are literally 1.5 days on average. So here is data from the COVID symptom study, the Zoe app from King's Hospital, which is a fantastic. This is Christina and Tim Spector who put this data together. There are 4.5 million people with the app, and 1 million are being followed up, and 280,000 people have submitted data saying, actually, when I had the flu, when I had arm pain, it literally only lasted about a day and a half after the first dose, and less than 4% of people are reporting these side effects. After the second dose, there seems to be a little bit of increase, but again, it's gone within about 2 days, really reassuring. And if we look at, this is the most fundamentally interesting slide. This is healthcare workers that are within the app telling us what's happening to their tests of antibodies, which we have to do twice a week to prove whether we're antibody negative or positive before we can go to work. And this is based on about 13,000 people reporting their data as healthcare staff, telling us that when I get vaccinated, this is the red line, and I've had my vaccination, and here's my vaccine card, guys, etc., that not only after about 12 days, not only am I less likely in the future to get COVID from the hospital as a member of staff, but actually look at the blue line of the people still yet to get vaccination, and that line is also coming down. I'm protecting myself and I'm protecting my fellow staff by getting vaccinated. After about 12 days, we're seeing this 50% reduction in our likelihood of staff as becoming antibody positive, which is a surrogate for, am I going to get the infection itself from my patients or from other staff? So this is a double whammy. And so I thought that was a really nice piece of data. And this data is literally less than 3 days old. And so we're very blessed to have this sort of data in the public domain. This is volunteered data from us as the real world. The US has nothing like this. And so we're so blessed that no other country is that beautifully rich in data. So as we talk about that, Arshna, you as a pharmacist, what are your thoughts about this MHRA data, the reporting system, and this Zoe app data?
The first thing to say is that the MHRA, the UK's regulatory agency, the government's regulatory agency, is one of the strictest in the world. So this myth that actually they're just going to let any old medicine through, any old vaccine through, is totally misplaced. We have one of the most well-regulated medicines agencies in the world. And really, that you have to jump through so many safety checks, hurdles, clinical trial data before it even gets to the table where it's looked at. So the first thing to say is that we should all have confidence in the MHRA's data and approval of the vaccines. The second thing is the yellow card scheme. It's widely available for anyone to report. So even you at home, if you've had the vaccine, you feel a bit off color, you can actually just Google MHRA yellow card and enter in your symptoms, your data, and it's captured in real time. And like you said, Ameet, it's in real time. I mean, the data we're sharing now is 3 days old. So, and it covers every single report that's come through. So we know the side effects are not serious. They're not harmful to the point where they're going to cause irreversible issues. Yes, people are all different. So some people will have different side effects to others, but that's because our bodies are all different. We all react differently to the same things. So it's important to bear that in mind. The other thing also to bear in mind is the fact that the side effects reported from the vaccine are far, far less than what's even been reported for simple medicines like paracetamol or aspirin, which we're more than happy to take without even thinking. So, I think it's really important we put it into context. So when we look at the news and we see all these reports of, oh, this person had this and this person had that, and okay, there's going to be hives and there's this and that and the other, we think of it in context. We're getting far more side effects from simple, well-known remedies than we are getting from the COVID vaccine. So a lot of our worries are very much misplaced. And that's something really to drive home. And that's the data saying it, not me, not you, Ameet. It's actually the data, the evidence that we're looking at. And this evidence is being updated all the time. And the best thing is anyone can look at it. You can all just Google it, download it from the government's website and look at it in real time.
And this is the beauty, isn't it? That you can do your own research from the sites that you know and trust. And perhaps our job is to guide people to those sites. Nihar, I'm going to come to you. Is that reassuring? The vaccine side effects is a lovely comment that Arshna has made, that actually these side effects are less than the side effects you get from many medications. And certainly if you represent them against COVID itself, you know, imagine there's COVID, hospitalization for 20%, 5% needing ITU, and a death rate around 1%. And then you've got these 2 to 4% of impact of side effects after the first and second doses. What are your thoughts?
Yeah, no, absolutely, Ameet. I totally agree with what Arshna has said. Don't forget, you probably, as an audience here, you probably have a greater chance of being involved in a road traffic accident or possibly even being hit by lightning than having a serious reaction to the vaccine. We in the community where I work in Harrow, we have been vaccinating for quite some time now. We've done over 15,000 vaccinations. And to be honest, the majority of the side effects, as you mentioned, last between a day to day and a half at most. And it's simple things like arm aches, mild temperature, perhaps feeling a bit more tired than you normally do. But within a day and a half, it goes. What is the guidance that you have? It's, if you have a fever, you take paracetamol, which actually, if you read the side effect, as Arshna said, has a greater list of side effects than the vaccines. So we really, to be honest, in primary care, we are not seeing many people complain of side effects. Don't forget that the reporting is done. The people who report side effects will often have side effects with a lot of other medication as well. So most people will have absolutely no side effect with the vaccine whatsoever, apart from perhaps a slight arm ache at the site of the vaccination jab. Very similar to flu. If you look at people who take flu almost on an annual basis, they have a much greater incidence of side effects than they are getting with this vaccine.
That is so reassuring, Nihar. You put it into very much context about the flu vaccine, etc. Raj, you had a comment on the vaccines, the side effects, the data?
Yes, first of all, actually, as everybody said, it's a no-brainer, right? I mean, listen, the risk-benefit of taking a vaccine or not, it just, there's no argument anymore. There's so much data showing vaccine saves lives, vaccine saves hospitalization, right? What was interesting from what you were saying, what you showed was that blue curve, right? I.e., by you taking the vaccine, you are actually preventing others from getting infected, which is very interesting to me. And that actually, that goes back to what I was talking about, the younger people, right? I feel at the moment there's a misconception in the younger people in our community and outside that actually, hey, this is the flu. I don't need to take a vaccine, right? I'm talking about, the middle-aged and young adults, right? That's not the case. By you taking the vaccine, it's not just about you protecting yourself, which you absolutely must, because you could still end up in hospital and get long COVID, right? But it's about protecting others as well. So absolutely. I would urge anyone who gets chance to get the vaccine, who called at your age group, don't delay, get it.
Fantastic. And actually, one of the pieces of data I didn't actually have time to show from this is that who currently is actually getting COVID-19. And it turns out, of course, that the most commonest group getting COVID-19 is 20 to 29-year-olds because they haven't been vaccinated yet. But actually, the rates of COVID amongst the over 75s has completely crashed. These vaccines are absolutely making a major difference. That's why we're not seeing these people coming into hospital anymore, Arshna. We're seeing the 40-year-olds, 50-year-olds, the people who are waiting to be vaccinated, etc. Luckily, the 20 to 29-year-olds who are getting COVID are not necessarily coming in as much, but they may be at risk later on. We'll talk about long COVID, of course. Yeah. Now, I'm going to move on to a little bit more data. This time, Nihar, really something that's close to our heart, which is that, of course, we don't want vaccines to be causing, we don't want the virus, COVID-19, to be causing collateral damage. So here, I've actually put together a couple of slides first of all, what's happened to cancer in the last few months. With COVID and lockdown and everybody scared to come in, I know that cancer diagnoses have gone down by 40% compared to the average in 2018, 2019. Now, I know that cancer is still happening, but actually people are not coming through and coming forward for their actual symptoms, their early warning systems that we've spent decades creating in the NHS to say, if you've lost weight, you've lost appetite, you've got a change in bowel habits, etc., please go and see your GP. If you've got any lumps anywhere, please go and see your GP. So there's that one aspect I wanted to focus on. And then there's one other aspect which is very close to our hearts, because you and I have an expertise, obviously, in cardiology and diabetes. So first of all, real drop in cancer of prostate and bladder, blood in your urine and change of bowel habits. And then the next part, which is, of course, there's been a massive drop, I'm afraid, in heart attacks coming through. We know that they're still happening. People are sitting on their chest pain. People are sitting on swollen legs. Their heart is weakening. They're getting breathless. They think it's just because they've been at home being sedentary, but actually they're getting weaker hearts. They're sitting on that. They're not getting their tests. They're not being able to come to the hospitals for their echocardiogram, their ECGs. So they're not actually being able to be tested to find these diagnoses. Does this resonate with what you're seeing, Nihar? I'm going to come off the slides there. To say this is data from the BMJ. This is very well reported. In fact, a good friend of mine, Ameet Banerjee, was the group that actually created this massive data set from London.
Yeah, thanks, Ameet. You're right that if you look at the statistics, you would say the cancer rates are dropping by about 40%. I must say personally, I don't think that's true. I don't think that cancer rates have dropped. I'm sure you'll agree with me. It's not cancer rates have fallen. It's that people are not coming to see their GP or go into the hospital. And I think a large part of it goes down to people are scared. They're scared of coming into the general practice because they're scared of catching COVID from us. They're scared of catching it from other people, because traditionally the GP waiting room, if you come into my surgery on a Monday morning or a Friday evening, you've got 30, 40 people sitting in the waiting room. So people are scared of that. People are scared of going into hospital for tests if we are referring them to tests, because they're scared that they will catch COVID. And so I think, this would be a good time for me to just reassure people that we have taken a lot of steps to prevent you from catching COVID by coming into either a GP surgery or into a hospital. We've got social distancing, we've got masks, we have hand gel to keep things clean. We let very few people into the surgery at any one time. We're using separate rooms to examine patients, which are then wiping down and aerating. So people should have a lot of confidence in coming to see us, because if you do have any of the features of either heart disease or cancer, you do need to be seen. I think first message to say is that it is safe to come and see the doctor. The second thing is that when you come to see myself and I refer you into the hospitals have taken a lot of precautions as well. And these tests, for example, a chest X-ray, an ultrasound that needs to be done, may actually potentially save your life if you had cancer. So don't delay on not going in to see your doctor. I think with regards to the cancer thing, I just want to say, I have seen a lot of patients who have presented late. The story that strikes me the most is of a 42-year-old lady who had two children, a 10-year-old and I think 7 or 8-year-old. She had a lump on her breast, which she ignored. This was around October. In November, she presented to us because the lump had grown bigger and there was some skin changes around it. And by the time she actually came in to see us, unfortunately, that cancer had spread. So although she has now been referred to the hospital and is under chemotherapy, that cancer has spread. And this is a 42-year-old with 2 young children. So it would destroy the entire family. So I think the important take-home message here is that we are open. You must come into see us if you have these symptoms. We can talk about the different types of symptoms that, weight loss, change in bowel habits, change in your urine, blood in your urine. These are the common things that basically people are ignoring, and they shouldn't be ignoring.
That is a point really well made, Nihar, and I wonder if that was the same patient we saw, because there was a lovely 43-year-old mother who came into us, and she'd had lung or breast cancer. I'm not sure where it actually started from, and it had actually invaded the covering of her heart, and she had massive amounts of fluid, a pericardial effusion. Now, I haven't seen this sort of spread of cancer for years People are coming in late, we're having to do procedures on them that, we just have not understood. They're sitting there with large lumps going inside, causing swelling, causing problems, etc. And we're surprised, we're shocked that, things have got back to where we were 20 years ago almost with heart attacks and cancer. That's a point very well made. There's one important thing I need to say, guys. It's really important that you now start thinking ahead for the next 10 minutes. We're going to start Q&A. We've got some really amazing experts here. Please start putting legitimate question and answers into the YouTube chat itself so that we can actually take those questions over here and answer those. And I appreciate very much the kindness of some people wanting to put negative comments in here. And it's quite flattering that you've joined us, and very much appreciate that you believe this is a popular enough panel to come in and disrupt us. But actually, we're here to answer really important questions about what's happening in the hospital, what's happening with cancer, what's happening with heart disease, what's happening with COVID. And so it would be grateful if you'd respect that. Thank you so much. So what did you think, Arshna, about the cancers, the heart disease? Are you seeing those things? Are we still giving all of the new medications that are still coming through for diabetes? Are we able to do our work pretty well, or is it slowed down in the community and in primary care?
In the first wave last year, it was true that perhaps we just didn't know what we were dealing with, and things did slow down a little bit. But the NHS is really very much open for business this time round. We've learned the lessons from the first time round, and we're very much ahead of the game now. GPs are consulting in different ways. So whilst you may feel that your GP is not accessible, actually, if you go online onto their websites, most GPs in London have got something called e-consult, where even in the middle of the night, you can type in your symptoms and a GP will look at that within 24 hours and come back to you. So there are new ways of working. It's no longer the old, let me get an appointment and let me see what needs to be done. Actually, GPs are far ahead of the game. I know at the surgery where I work, we have 2 shifts that start from 6 in the morning that filter in all these queries that are coming through, consultations that are coming through on e-consult, and a GP's looked at it by 7:30. By 8 o'clock, you've had a phone call back. So there are really different ways of working now. All these diagnostic procedures there are open. Hospitals are doing them. It's not that they're not. So all urgent work is very much there. The NHS is open for business. And now we know so much more about COVID-19. We're able to protect you when you come into the hospitals, when you come into GP surgeries. So there shouldn't be any hesitation to do that. If there is a threat, you will be told well before, even when you attend for an appointment, before you even get to us, there's 5-7 questions. Have you had a fever? Have you had a temperature? Have you, are you coughing? Have you had a change or whatever? Even before you even get to the front door, we've asked you all these questions on the phone. So it's important you do that. All the drugs that we talked about, the new treatments, they're all out there and they're being prescribed to all those patients that reach out. So the thing that's lacking is you reaching out. So if you have a problem, reach out to your GP, and there's different ways of doing it. Email them, telephone them, go on e-consult, look on their website. There's different ways to access GPs now. So it doesn't have to be a frustration.
You're being quite modest, Arshna, because pharmacists and community nurses and physiotherapists and psychologists have taken so much more effort, because I think we've all realized that a single touch point with a patient, you have to help them even beyond your own specialty. Is that correct?
100%. And we're all working with very new skills, but different ways of working. And like you said, community pharmacists, huge source of information, and they can tell you straight off if something is serious or not. So worst case, speak to a community pharmacist. 99% of the time, they'll tell you where to go. And of course, NHS 111, open all the time, and they can definitely direct you in your health queries.
And one of the most exciting things is finally we're arriving in a world where the data is joining up. I can see GP summary data, I can see the patient's spine, etc. Okay, it may not be completely up to date, maybe out of date by a couple of days, but actually I can do that, and the GPs can actually see the hospital data sets, and so can the pharmacists. So we've finally arrived in a world where information transfer is trying to speed up to the point where it's almost, not quite, almost all in the same place. There's still people using paper at the moment, but COVID has done away with cash notes, and it's done away with hospital records. Everyone's starting to get electronic finally. So that's a new world. Guys, I'm going to just talk about, I'm going to start moving to us Q&A time so we can have a panel discussion. And before that, I just want to tell us about the really important thing about, if you've enjoyed this session, we need to know what you want us to talk about at the next few sessions. We think mental health is going to be really important and you'd like to understand how to deal with that in COVID. We think cancer, children's health, pregnancies, but we don't know for sure. You know, we have an amazing team from the Jane Health Initiative, fantastic people, pharmacists, specialists, you know, primary care, secondary care, etc. But we need you to fill in our survey. The survey will tell us what talks you want us to bring. We're here to serve you. And this is a really rare time because first time we're actually saying to the community, we're going to come to you and we're going to ask you in a survey what you'd like us to talk about, what format you'd like, and what people you'd like us to bring to you to give you those answers. So as we go into that Q&A, I'm just going to finally just touch on 5 seconds of if you are not familiar with where the survey is, it's going to be under that YouTube video. So you can see here, YouTube video, there's going to be a hyperlink just underneath that inside the YouTube. And just you can even scan in this QR code with your mobile phones. If you're watching this on the TV or if you're watching this on a laptop, you know, just touch it on your mobile phone and actually it will go straight to the survey site, and there's the link underneath that if you needed to use it. The link will be in the chat many times over. It'll start with this sort of question. It says, you know, here are topics that we want you to choose. Please rank which is the first one you want, the second one you want, the third one you want. And if we've missed anything, put it in the comments box. There's a simple, this will take you less than 3 minutes for this survey. And then we'll come to these final points to take home. I'm going to start our Q&A with the summary of what we've actually just discovered. We've talked about COVID-19. You must avoid catching COVID-19 pneumonia as much as possible. And that's really critical because especially if you may carry it to somebody who's vulnerable or if you yourself are vulnerable. COVID-19 mutations, Raj has told us beautifully, these are to be expected. But however, vaccines are actually going to be able to target those. We're already protecting, the vaccines already protect you against the severity of any infection, be it a new variant or be it a present variant, etc. Now, we've talked about the safety data, and we discussed that with Arshna, that these are sorts of things that are less likely. The side effects from the vaccines are less than we see with paracetamol. So that's really reassuring. Aspirin, paracetamol, taken over a week or so, are more likely to cause side effects than vaccines do, and contextualize that to coming into hospital. You do not want to see people like me in the hospital, in the A&E setting, in the ITU setting, etc. Getting that first dose, we'll talk about that timing in very shortly, but Nihar is doing so much work. At the Hive, where he works for vaccination, was visited by our Prime Minister, Boris Johnson, because it's one of the most efficient places for vaccination uptake. And that's actually lovely to see our community, our own personal community, having so few doubts. But if there are doubts, please put them in the survey. And if there's anything we can do to help you with those doubts, we will. And then the last message, which is the NHS, GPs, pharmacies are open for business. Please do not miss out on urgent things like cancer, heart disease, etc. Anything dangerous, you know, you must pester us. It might take a little bit of time because we're distracted with vaccines, but we will get to you within 24 hours, if not less. And there are very good phone lines, very good email lines. And in fact, e-casualties are still open and the ambulances will come out. And so very important, stay safe, do the survey. And now I'm going to introduce our young registrar GP, who's actually one of our favorite trainees. Mehta is going to join me, and she's going to help me manage a young mind and a young voice is going to help us manage the question and answer sessions. Amisha, please introduce yourself and tell us all about what's happening in the chat and what questions you'd like us to answer.
Hi, thank you, Ameet Bhai, and thank you to all the speakers and the specialists who have spoken so well today. I'd like to thank all the people who have been putting questions in the chat and continue to do so, and we'll move straight on to that. So I have quite a few questions coming in. I'm going to direct the first one to Raj Bhai, and a combined question. So what's the duration of immunity with the various vaccines? And with the 3 vaccines at present in the UK, they have been they've been quoted to be emergency use authorization only. What is your take on this, please?
Answer to the first question is simple. We don't know. We don't know how long will the immunity last. But I go back to the point I made before. You got to remember, when we say immunity, that's immunity from catching the virus. However, it's more important that it actually saves you from getting severe disease and hospitalization as well. So we don't know how long it lasts. Clearly, it's lasting till now. There's a lot of attention being paid to that. People are monitoring that. We will know in due course. And the second was about the 3 vaccines. What was the second question?
Emergency use or
emergency use only. That is essentially a way of the MHRA saying that once it's approved, we still need to monitor what's happening. Okay, so it is a lot of times when it's fully approved, that means fine, this is great, just go ahead and give to the rest of the world. What the MHRA is saying, and all the rest of the world is saying, that this is safe, the vaccines are safe, they're efficacious, but we still need to learn more about them. And that's what the emergency use means, that look, on balance, we need it right now, but all the pharmaceutical companies are telling them, keep on top of it, monitor the side effects, monitor how long it lasts, and so forth.
Perfect, thank you. And we have a lot of vaccination questions, so I'm going to spread them across the panel. So the next question is to Nihar. Some people are noticing that they're having rashes after having the COVID vaccine, and especially things like hives. Will that occur after the second dose as well, or is that a common symptom?
So from my experience of vaccinating, the second dose doesn't give you the same symptoms. It's usually it's the first dose. But in terms of the rashes, don't forget, people just need to be aware, COVID itself can give you a lot of rashes. Just because you've had the vaccination doesn't mean you're safe from COVID. It often takes around 2 weeks before you start getting the immunity to develop, and you're not fully protected until the second dose. So if you are getting symptoms such as severe rashes that are not settling down, you still need to seek medical attention just to make sure that, for example, you haven't caught COVID in between the first and the second jab. The majority of the side effects you would get tend to be after the first dose and not the second dose.
Perfect, thank you. Arshna, we have a question here with regards to vaccines and if there are any side effects if you are diabetic. Please, could you expand?
So some people think actually being diabetic and if your sugar control is quite poor, your immune system does work slightly differently. You are more immunocompromised. That doesn't mean you're going to get different side effects. You will have the same sort of plethora of side effects that can be expected. And most commonly, it's just a sore arm, a tiny bit of fever, or that body aches for 1 or 2 days after. It's nothing special because you're diabetic. But the one thing to remember is if you are diabetic and you are offered the vaccine, it's even more important that you take it, because if your sugars are not well controlled, you are more immunocompromised. And we know that the complications of COVID are much higher in the diabetic population.
Thank you very much. Ameet, there's a question here with regards to research. Are there vaccines and research, are there toxicology reports and results of the trial for any of the vaccines being proposed or given?
So we are actually measuring, you can't measure vaccine levels, you measure the response to the vaccine per se, so antibodies and what is the progression of people converting. So one of the things you can see from the Zoe data alone, you can see that people were becoming PCR positive or negative, whether they'd had the vaccine or not, and actually that rate was coming down. And what we would do is measure antibody levels. Toxic levels usually occur when you're giving a medication in too big a dose. Now, phase 1, phase 2 studies, we actually learned what was the dose that should be given to create a research like this, to create a response like this, what was the safe doses. So those studies were done in phase 2. So that is always a question of, what dose is the correct dose to mediate and create that antibody response without causing harm to you. So in that sense, the phase 2 studies, but the phase 3 landmark studies don't need to do that. They need to prove safety, they need to prove effectiveness and the deliverability to all different types of groups of people.
Thank you.
I'll just add to that, like Ameet said, toxicology in terms of actually if the questions about whether people are monitoring through the trial, whether what the toxic side effects were, absolutely every step of the way, and that is a critical part, the part that the MHRA will look at before they even think about approving.
Thank you. And I'm going to stick with you because there's a question with regards to, well, both of you, with regards to the MHRA. Would the MHRA contact the reporter following a yellow card report to follow up?
Yeah, so I can help with that. With the yellow card system, they would only contact that if that has been a death or something really seriously unexpected. Absolutely. If it is to be expected, they're collecting that data and they don't need to. So they'll make an evaluation because they have to actually verify those symptoms. They'll catch up with you if it's something really unexpected. So if you suddenly said I went deaf after the vaccine, absolutely, they would be straight on to that. But if you said I've got arm ache, I've been tired, if it's to be expected amongst those curves of the symptoms that I said, you know, my joints ache, etc., I'm tired, I'm sleepy, etc., just for a day, those sorts of things they're not going to contact you with.
Thank you. A question for Nihar Bhai and Raj Bhai. Somebody's written, have any vaccine trials been done on the elderly people with Parkinson's? And then a follow on to Nihar Bhai, has a panel seen evidence in elderly people with progressive diseases, an acceleration of symptoms if they had a progressive condition?
So as far as I know, there hasn't been any specific trials for the vaccines on neurological condition, elderly people with Parkinson's or dementia or Alzheimer's. They haven't been focused on those people, but I do know that a large number of elderly people were enrolled in the trials, and we know now that millions of people have been vaccinated. All of these people are being monitored by the GPs, right? So if the symptoms worsen after vaccination, people will catch up on that, will pick up on that. I'm not aware of any incidents or any reports that saying that the vaccine actually accelerates or has any effect on those disease per se. Nihar, I don't know if you've heard anything.
So I agree. I don't know the exact numbers, but I know that there were some people with who had Parkinson's who were included in the original trials, especially the Pfizer trials. But in general, most of the trials they weren't specifically powered to say whether you can use them in patients with Parkinson's or not. In answer to your question about the progressive nature, there's so far from the people we have vaccinated, I've not come across anyone where there has been any acceleration of their underlying disease or condition. Don't forget that patients who have things like Parkinson's disease or dementia, etc., are generally much older and therefore are the very people that we do want to protect, because if they catch COVID, then their risk is substantially higher. So we do want to target them. We haven't seen any real acceleration of disease or side effects or increase in side effects for them.
Nihar, I've been keeping a really close eye on a lot of the patient associations, because there's a lot of people with motor neurone disease, there's a lot of people with cerebral palsy, etc., and they've been really worried about what's happening. And actually, each of those specialist bodies have been getting data from their own members that are being vaccinated. And so far, not one of those member bodies has said, hey, we've seen any problems. Now, with the vaccines, you've seen a transient Bell's palsy, so a transient paralysis of that, but it's not with the vaccine. It's actually the normal background rate that happens to all of us that we're seeing. So there's a few reports there suggesting, hey, Bell's palsies have been seen in the people on the vaccine and the placebo, exactly the same rates. So other than the anaphylaxis that we've seen reported for people who are at risk of getting anaphylaxis anyway, we know about those. There's been no major, I've looked through that MHRA report in detail, and there's been no major neurological conditions, progression, disease at all so far. Yeah.
Very much.
Michelle, back to you.
Yeah, sorry, thank you. I have a few questions for Arshna Ben. Arshna Ben, does anosmia and the lack of taste recover after recovery from COVID?
So it does, but it can often take several weeks, if not months. So one of the things that you can do to help yourself is two things. There is some anecdotal evidence that taking B complex vitamins can help to recover the sense of taste and energy and fatigue. But that's anecdotal. We don't have enough hard clinical trial evidence for that. The second thing is the use of perhaps a steroid nasal spray like you would for hay fever has shown to actually help recovery of this a sense of smell. Using saline nasal sprays to help just rinse the nasal passages, keep them clear, has also shown to help, but it can often take several weeks. So I'm talking about 6 to 12 weeks before that recovers. So it's a slow process, but there are things out there. And if you do struggle with that, please speak to your GP who can help you and signpost you to the right treatments that can help. But it's a long process of recovery.
Thank you very much. And that ties in nicely to the next question. Does the inhaling of steam or steam vapors, can that avoid the COVID infection or healing if one has COVID?
So there's a lot of anecdotal evidence around this, that actually even in Ayurveda, that any kind of steam inhalation can actually help to reduce viral particle load. So Ayurveda and Eastern philosophy very much believes that this can help. Any kind of steam inhalation basically loosens mucus inside the nasal passages and in the upper airways. And that helps your body to clear things away much quicker. So if nothing else, you're probably quickening the rate at which your body's natural mucus is clearing away virus particles. So, that's one thing to think about. It's not been clinically tested in the West, so we don't have a clinical trial looking at steam inhalation in COVID patients. But, it doesn't do you any harm either. So it's worth thinking about as an adjunct, especially if you suffer with COVID symptoms where you have a blocked nose, you have a runny nose, which in the newer variants, this is prevalent. You can have upper respiratory tract symptoms with it. This can be helpful just to ease symptoms. So it's not going to make it worse. We don't know for sure with hard evidence whether it cures it or stops you getting COVID, but there's no harm in doing it.
Sure.
However, one thing I would add to that is I've seen a lot of posts around the world that steam inhalation can prevent infection. If you want to try it, by all means try it, but please do not substitute that for lockdown, for social isolation, for washing your hands, keeping a distance, all of that. Keep on doing that. Do not
absolutely
do not substitute.
Agreed. And I think you've mentioned to me before, make sure we're careful so we don't burn our nasal passages. And then the other thing is exactly what you said, Raj, by hands, face, space, make sure we carry on with that. I do have...
Can I just say that it's quite well, it's out in the public domain. A lot of people do think that, if you get the anosmia, the loss of smell and the loss of taste, your COVID symptom hopefully will be a lot milder because it hasn't actually got into the lungs, into the pulmonary system. So you hopefully have a much milder form of disease with just maybe a cold and a slight temperature, and that's it. So that's just something the audience might want to know.
Perfect, thank you. Nihar and Arshna, there are quite a few GP questions. Why are doctors not making the use of herbal use, as Arshna has already mentioned? But sorry, another question that I wanted to ask was, what has happened to the deaths from flu, and why the overall stats for flu dropped completely this year round?
So with the flu answers, there's a number of reasons. Don't forget, there was a huge drive for everyone to get the flu jab, and year on year we've been doing the flu jab, so people have some innate protection from that. Flu plus COVID increases your mortality substantially, possibly by a factor of 5. And so even this year we had a huge flu drive to try and prevent people, even way before the COVID vaccine actually came out. The other thing is, don't forget, we've been in lockdown. We've had the hands, face, space message. People have been staying at home and not mixing. People have been staying more than 2 meters apart from each other. People have been wearing masks. So the transmission rates of flu have dropped. and therefore the mortality from flu has also dropped. Less people have caught it. It's almost like flu is now non-existent because we're just focusing completely on COVID. That isn't quite the case. People can still get flu. People are still getting flu, but because we've got the flu vaccination program, and that has happened before the COVID vaccination, that has substantially dropped the numbers.
Thank you. Another GP question. It's very difficult to get my GP appointment, somebody has written, and somebody else has written that my GP is only doing telephone consultations. So what should the public be doing in these situations if they're trying to get a hold of their GP or they're trying to get physical consultations? And that's to you yourself, Nihar and Arshna, as she works very much in a GP practice. Thank you.
So if I can go first, I think there's one thing that we need to understand is that actually the pressure on GPs is a lot at the moment. They're not only dealing with workload issues, so we have GPs who are off sick, we have staff who are off sick as well. But I think the expectation of the way we used to work before, where you get an appointment, you come in and you see your GP, that way of working has changed. It's become much, much more efficient. A GP can, on the telephone, actually ask you all the red flag questions. So those are the questions which a GP would need to know the answers to decide whether you have a serious condition or a not so serious condition. So they will ask you all those questions. And if you answer honestly when they do telephone you, that GP will then decide, actually, I need to see that patient. I need to examine them and bring them in. However, there will be a vast majority of people who don't need examination because their diagnosis is quite simple, and therefore they do not need to be brought in. Remember, as much as protecting all of you coming into a GP practice, we need to protect our GPs as well, because if they all go off sick with COVID, we're not going to have an NHS left to be working. So they are screening things very, very carefully. The old way of working has now been replaced with much more efficient telephone triage, e-consults on websites. You can email in your symptoms. There are so many new ways of reaching your GP. Don't wait for an appointment and a phone call to come and see your GP, because he can do things in a much more efficient way. Nihar, what do you think?
I totally agree with what Arshna said. I totally echo what you said. I can't talk for every single GP surgeries, but certainly the majority, 99% of them, will be doing what my own surgery does and what it sounds like what Arshna's surgery is doing. We have e-consultations, we have telephone triage, we also offer video consultations, and if you physically need to be seen because you're either very ill, you're very elderly, babies, for example, someone with, for example, that we suspect might have cancer, like they have a lump, etc. We will bring them in a safe and secure manner. We will physically examine them and we will treat them in the more traditional way. But if we can do something over the telephone or over a video now, that's how we will do it. The NHS is open, GPs are open, hospitals are open, but it is now a matter of talking before you walk. So we will take a very detailed history on the telephone. We will then bring you and examine you, and then we will give you your diagnosis, etc., again over the telephone. So you will be seen if you need to be seen.
Thank you very much. So the message is NHS is open and GPs are open. So please do contact your GP. It's just a different way of delivering the service. I have a question before we move on to the long COVID questions. There is a question with regards to vaccinations. A couple of people are asking about the 12-week gap. It seems likely we all have to be vaccinated. How long will this carry on for? Will it be infinite? And I've already had one vaccine dose already. Is it worthwhile me taking vitamin D in between? I'm going to direct that towards Rajbhai and then Ameet after that. Thank you.
Let me talk about a little bit about the 12 weeks. And I think that's been a lot of debate, a lot of concerns, even within my own family. What's the effect of 12 weeks versus 4 weeks or 8 weeks that the trial was shown that works. So let's make it clear, first of all, The trial was done in a specific time frame, and it showed that it was efficacious during that time frame, whether it was 4 weeks or 6 weeks or 8 weeks between the two doses, right? What do the two doses do? The first dose gives you a real big boost in antibodies to the vaccine, to the COVID, right? And the second dose actually gives you even bigger boost. So it's a large amount of antibodies, and then even more antibodies after that. What we know from all the immunology that we're doing, the scientists are doing, all the experience we have from previous vaccines, that actually the dose, the time between does matter, but not hugely, right? Yes, there will be a difference between the boost, how long after you give the boost, but not massively. The problem, the thing that we got to remember is we are balancing now. This is all about balance, right? About getting a large number of people vaccinated with still a very good levels of immunity, as opposed to a smaller number of people with even better immunity. However, what's interesting, actually just last week, and this is something that's really becoming fascinating, a report by the Oxford scientists came out that actually leaving it for 12 weeks before the two doses gives you even better protection than leave it for 4 weeks, right? So not only now you have a possibility of actually getting a large number of people vaccinated with the first dose, but also actually after the second dose, you're going to even get a better response, at least for the AstraZeneca vaccine.
I can just make one small comment on that, that if you're trying to vaccinate at least 12 million people, which are the most vulnerable, and the healthcare staff, you cannot get confused by the idea of, hey, am I doing you? And is it your first vaccine? What's your vaccine? Our data systems and things like that to coordinate that is so difficult. The most important thing I've shown you from that Zoe data is that if we get everybody vaccinated, you're protecting yourself, and more importantly, you're protecting all the others around you because you're not spreading it. And for staff, that is absolutely pivotal. You know, in between the first wave and before vaccines were coming, about a quarter to a third of our staff were going off sick at any one time. We were all having to do double shifts, triple shifts, etc. It was horrible not knowing, you know, every day you came in, am I going to have my team? Am I not going to have my team? Am I going to be able to be there? Etc. And so that has now completely just gone away. We are back to opening up. And I think there was a question about operations. You know, we cannot wait until the peak has not only finished its admissions, but actually we're discharging more and more people. And once those beds are finally starting to open again, we're going to be not only back to our usual levels of working for those operations, but we're going to play catch in hospital sites where possible to do those and clean pathways to catch up with a lot of those operations. And the cancer operations are absolutely first and foremost, then the cardiac operations, eventually the hips and knees and so forth will get there. I think mentioned something about the herbal medications question.
Yes, yeah. So just to reiterate, vitamin D can be taken pre, post, and during the vaccination, and should be taken throughout the winter months. I'm just going to ask, Arshna Ben, please could you answer a question that I'd asked earlier with regards to herbal medication and COVID?
Thank you. So there's a couple of things. I know that there are a lot of viewers out there who want to know about which herbal remedies might work, might not work. The truth of the matter is, treating COVID just like you would symptomatically, herbal remedies, we don't have enough scientific data around which herbal remedies work with COVID. And so taking them in place of conventional known medicine that we know works is really not a good idea. That's the first thing. The second thing, there are some things which we know help to boost your immunity. So ginger water, ginger tea, keeping hydrated, making sure that you're having herbs which actually help boost immunity, which we know are there. Natural remedies can help, but they should not be used in place of conventional treatment that your GP or your doctor or your hospital may recommend for you. In terms of taking herbal remedies with the vaccine, there is absolutely no evidence that taking herbal remedies with the vaccine has any harm. You will still have the same effects of that herb as if you were taking it at any other time. The vaccine has no interaction per se with those herbs. Now, about homeopathic vaccine replacement, there's a lot of press out there about homeopathic vaccines. They're called no-sods. We have no scientific data that they work. So there is no clinical trial out there which shows that any homeopathic no-sod can prevent you getting COVID. However, there may well be work in progress. So when that data is published, I'm sure we'll be able to discuss it. But currently, there is no scientific evidence of that.
Okay, and I have a question with regards to long COVID. Ameet, I know we're coming towards the end of the session, but if you could tell us a little bit about long COVID, please. And all of your final thoughts would be very much appreciated. So something from all of you. Thank you.
And again, thank you so much about this question about long COVID. One of the beautiful things about this country, again, is we've got a National Institute of Clinical Excellence that gives us guidelines. And in fact, a few months ago, they actually came out with this fantastic guidance in 18th December on what is long COVID. That means if you've got persisting symptoms, be it in your lungs with a cough and so forth, breathlessness, particularly with the heart, a lot of people get fast heart rates. A lot of people feel dizzy when they get up. A lot of people are tired and sleepy. Some people are getting earache. Some people are getting dizziness, the fatigue, and some people have gut COVID and they're getting diarrhea, etc. So here are the sorts of symptoms. If they're persisting beyond 3 months and it's stopping you working, etc., then these are the sorts of guidances to look at that you may have long COVID. Now we're learning about what therapies might be able to help you with long COVID and we're doing clinical trials on exactly those sorts of people. So please come forward if you've got long COVID. Please make yourself known to your GPs and your pharmacists, etc., because we are looking at medications that may strengthen you, help you. And in particular, we know that COVID has other ways to harm you. It's not just the pneumonia. It can actually cause clots in your lungs and in your legs and in your heart arteries and give you strokes. It can actually cause gut COVID and cause you to lose a lot of weight, cause you to have really bad malabsorption syndrome. It can affect your nerves. You can actually get encephalitis. You can get all sorts of unusual things. And for the young people, you may be able to get through COVID without even batting an eyelid for 3-4 days, but you don't know if you're going to be the person that will get long COVID and 2-3 months down the line, you're completely dizzy as hell and you can't go to work. And so that is actually another good reason for vaccinating everybody, because you don't know if you're the one who's not going to be able to take exams or your driving exams, etc. And I'm sorry, I'm not meaning to be scary, but we're seeing young people who are literally getting palpitations every time they go up the stairs. And actually we're having to look at them and see what's gone wrong with their electronics of their heart and so forth. And that's quite common for us. We're actually doing a very large study of long COVID in London. And we know that there are at least several thousand people just in London alone with long COVID. But again, there's beauty of being able to look at the internet to see in this country that we have all this sort of information in the public domain. Hope that reassurance is there. We'll go to final comments, unless there's any last questions you want us to take, Amisha.
A very quick question. School reopening is a key event occurring around March the 8th, we think. Do we know if there's going to be testing with regards to this, Nihar? And then thank you for your comments so far.
Yeah, so with regards to school, most schools have now got lateral flow tests. So lateral flow tests are very quick tests that you can tell if you are COVID positive or negative. It takes about 30 minutes to do. So it's a simple swab of your nose. It's a little bit like a pregnancy test where you can then, you get 2 lines which will tell you if you're positive or not. So most schools are going to be doing that. Hopefully a lot of the teachers will be in part of the vaccination drive and may well get vaccinated. In terms of when schools open and for how long, because we're talking about staggered school openings, so different years going in on different days, that really is a matter for the government and the politicians.
Thank you.
Does that answer the question?
Yeah, no, that perfectly did. I'm going to hand over because we don't have long left. So to Raj Bhai, Ameet Bhai and Arshna Ben, a few last comments, and I'll leave it there. Thank you very much for answering all the questions.
Sure. I mean, from my perspective, I think there's a few overarching messages. Vaccines are a no-brainer. If you get your turn, please go and get it done ASAP. Few things that's come out of this talk today, hopefully. First of all, vaccines not just preventing you from getting the disease, but even if you do get the disease, despite having the vaccine, it will be less severe. It will stop you from getting to hospital. It'll stop you from dying. So that's a one take-home message. Second take-home message, these mutations, these variants that you keep hearing about, these are normal course of event for a virus. You know, every virus does that. Flu virus does that. HIV does that. It's not specific to COVID-19. However, that brings me to the third point I want you to take home. Scientists are at work at tackling these mutations. The current vaccines may not work against all the mutations as efficaciously, but they still do work. And on top of that, we have other vaccines coming down the line. We have improvements of current vaccines that will tackle these new variants. So you shouldn't be very concerned about new variants. Just get whatever vaccine you can and protect yourself.
Yeah.
I wanted to just say final words to really just say that I don't think we should be afraid of COVID anymore. We know so much about it. The hospitals, there's so many research trials. We know so much more information. We can treat it so much better. And if you have family that go into hospital with it, or you do get COVID yourself, don't worry, stay positive, stay well, stay mentally focused on getting better. And get help. Don't feel embarrassed to talk about it. The more you talk to your family and loved ones about it, the more support you have. Reach out to your GP. If you think you have long COVID symptoms, reach out to your GP. They can put you in on all these trials and data and information, put you in touch with the experts that are dealing with these issues right now. So don't be afraid of COVID. It's something that's here. We have to deal with it, but stay positive. That's my message.
That is such a lovely message. And you've just reminded me that actually it's more anxiety making to do this actually event here, this COVID event of Zoom, than it is seeing our patients with COVID. Actually going into the hospital, I feel absolutely confident that I can do my job. I am protected and I can look after people. And it's like no brainer. You know, what's actually difficult is how to convey information to people, to persuade people that this is a gift for us. You know, we are able to manage these conditions. We're able to take the fear away, and all you have to do is reach back out to us. You know, we're here for you. And that's where I wanted to talk about the Jain Health Initiative, guys. You know, this has been a wonderful initiative that the One Jain organization has given to Ashwin Bhai, Nemish Bhai, and others, etc., to put together, to bring us all. There are at least 25 healthcare practitioners and professionals just already, and there's more to come, to bring together to you lots of help. The most important, hardest part for me, and I'm sure it is for all my friends here, is prevention. We cannot prevent unless we can get through to you. We know how to prevent most of the things that are going to happen in the Western world: diabetes, obesity, heart disease, high blood pressure, respiratory disease, pneumonia. We can prevent those, but you need to be able to let us reach out to you. You need to come back, answer the surveys, engage with us, give us your email addresses to be able to contact you and say, we've listened, this is what we're going to put on for you. And then we can actually do this prevention. This is for our community. COVID has told us one most important thing. Doesn't matter how much resources you have, doesn't matter what aspirations you have, life is precious. And the most important thing is to be empowered to look after yourself and the people around you, the community around you. And with that, I'm going to close this off. I'm going to hand it over to Nemish Bhai, and I'm going to just show that one last slide again with the take-home messages. Very simple. I'm not going to read those out. GPs are open for business. Vaccines are no-brainers. You know, this is a good time to be reaching out to healthcare professionals. 1 in 60 of us in this country are healthcare professionals. So we're all here for each other. And then, of course, please finish the survey. Thank you so much. Nemish, I'm handing it over to you.
Nihar Bhai, do you want to just say a last word before Nemish Bhai comes on?
Yeah, thank you. I just wanted to say one thing was the NHS is open, which Amit has kindly covered. But the only other thing I would say is, from my experience at vaccinating at the Hive in Harrow, please, for everyone who gets an invite, it really doesn't matter whether you're going to get the Pfizer vaccine or the AstraZeneca vaccine. The type of vaccine doesn't matter. We have 3 at the moment. We may have 4, 5 soon. The most important thing is to take the vaccine that you're given. Do not cancel your appointment because your friend had, for example, the Pfizer and you're being offered the Astra. They don't matter. It doesn't matter which one you take. The main thing is take the vaccine.
Super. Thank you so much for those last words. Naresh Bhai, over to you. Thank you.
Great. Thank you, everybody. That was a really fantastic series of questions and answers, as well as the presentations. So just to summarize again really quickly, vaccinate, vaccinate, vaccinate. Okay, most important thing. I found that really very reassuring overall. A lot of clarity about a lot of the things floating around on social media, so I'm really grateful to you. And the good thing was we got a really broad picture, not very specific things, but a really nice, clear, broad picture about the approach that we're taking to the vaccines, to COVID, and to dealing with it. And in particular, Raj's explanations of how vaccines work, how the tests have been done, and that understanding will hopefully help you also pass that information to your friends and your family so that you can clarify for them as well, and not to be worried about all the news all the time. But the most important thing is that the vaccines work and that the vaccines will help you by reducing the severity of your symptoms. Okay, so again, thank you all very much for that. And Amit particularly for putting into perspective the safety and the data around it that we're gathering from the results that we have so far, and that should really help you watching feel very safe that the UK has done a really good job of this, and we're monitoring as we're going day by day what's going on. So that is just amazing. We really want your feedback. Amit talked about this before, and we really need your feedback through this survey. If you please just take the 3 minutes, fill that in, and tell us what you felt and what more you would like to see. It will help us really plan ahead and start picking up the next topics. COVID will hopefully come to an end very soon. We're on the way out, and we start looking at the other underlying issues we had before COVID came in. So finally, thank you to all the panelists, Dr. Ameet Bakhai, Dr. Nihar Shah, Dr. Raj Mehta, and Dr. Arshna Sanghrajka. And Dr. Amisha Mehta for that wonderful series of questions and putting them so clearly. Okay, we had a team of moderators behind the scenes, Dr. Suraj Bafna and Dr. Sonali Sangvi. Thank you for your help. The IT team for making everything work well together. And finally, a big thank you to Nilesh Bhai Shah, President of Oshwal Association UK, for coming online to talk about his personal experience. And I would hope that somebody in that position taking the vaccine and saying that it's perfectly fine will reassure all of us that it's a good thing to get done. And as Nihar Bhai said, when you get the appointment, please do not at the last minute change your mind. Please attend that appointment. If you don't go, the vaccine gets wasted, the time gets wasted, and all the people who volunteered to go out there and help all of us, they just can't do it because you have just taken a slot and then not used it. Please go for the vaccinations. It's really important. Our next event will be in March. Up until then, thank you all very much. Stay safe for yourselves and for those people next to you. Good night.